Hello and welcome to another Excel NCLEX question of the day. A client with a hemothorax has a chest tube in the fourth intercostal space connected to a chest drain similar to the one pictured on the left. 4 hours after insertion, which client outcome should the nurse consider to be within normal limits for this client? Answer 1. Vigorous bubbling in the suction chamber of the drainage system. 2. No fluctuation with respiration in the water-sealed chamber. 3. Fluctuation with respiration in the water-sealed chamber. Or 4. The non-occlusive dressing over the insertion site is clean, dry, and intact. The correct answer is option 3. Fluctuation with respiration in the water-sealed chamber. Let's see why the other choices are incorrect. Vigorous bubbling in the suction chamber of the drainage system is wrong. Only gentle bubbling is acceptable in the suction chamber of the drainage system. Option number 2 is wrong. It says no fluctuation with respiration in the water-sealed chamber. That is not normal. We want to see fluctuation with respiration in the water-sealed chamber. We want that every time the patient breathes, takes a deep breath, and lets it out, that the water in the water-sealed chamber is moving up and down with each breath and each time they exhale. Option number 4, the non-occlusive dressing over the insertion site is clean, dry, and intact. That is incorrect because chest tube insertion sites should be covered with an occlusive dressing. So let's talk more about this topic. What is a hemothorax? So there's 3 different types of situations where the lung is not able to fully expand. So when you have a hemothorax, which is what we're talking about in this problem, you have blood between the lung and the chest cavity. So you can see in the first set of lungs, the first pair of lungs, you see the lung on the left side, which is the right side of the patient. The lung is fully expanded. It's taking up the whole pleural cavity, right? And then we see the one that has the blood, so the lung is collapsed. It can't expand. So that is an issue, and we need to insert a chest tube in order to drain that blood, okay? So a hemothorax is when blood is where a lung should be. Okay, because you see in the patient's right lung, you see it's fully expanded, but in that left lung, you see that blood is pushing on that other lung and it's collapsed. Then we have a pneumothorax, which is when air is between the lung and the chest wall cavity. I say that that's where, when air is where the lung should be, because air should always be inside the lung, not around the lung. That air is pushing, is causing pressure on that lung, and now that lung is collapsed. It can't open fully, okay? So breathing and oxygenation is being impaired. Then we see a hemopneumothorax, which is a combination of both, which is when there's air and blood pushing on that lung, it can't fully expand, okay? The treatment for a hemothorax, usually, I know that saying the cause is not the treatment, but usually the cause of a hemothorax is from an injury, like a blunt force trauma. And when I say blunt force trauma, something has hit the chest very hard. Maybe it could be a steering wheel in a car accident, and it caused a rib to poke the chest cavity. So treatment would involve stabilizing the patient and then chest tube insertion to drain the blood from the pleural cavity so that lung could re-expand. Okay, so this is an example of a chest tube insertion site, and then we can see that it's covered with an occlusive dressing, and that is the appropriate dressing for chest tube insertion sites. So some chest tube basics. R, you have the water seal chamber, which I'm using the orange arrow to show you. The tip of the tube is underwater so that air can't get back into the chest cavity. Okay? Then you have a collection chamber. This is where the fluid coming from the patient's chest cavity is going to drain into the collection chamber. And you as the nurse, you have to assess the fluid coming into the chest drain to see, is it bright red? Is it coming in too quickly every hour? Okay. So now, there's two types of chest tubes. You have a wet system and a dry system. So both the wet system and the dry system have a collection chamber, which is the 3 columns that we talked about from the previous slide, and then a water seal chamber, okay, which is to make sure that air doesn't get back into the chest. Now, a wet system is different because if you see, it has this column right here, that is called water-filled suction control chamber. So that is filled with water, and that causes the suction in the system, okay, to be able to pull the blood or the air out of the chest cavity. In a dry system, we're not using water for suction, okay? What we're doing is there's a knob, as you can see by A, there's a knob on the device, and you set that knob to the desired suction, then you turn on the suction on the wall. When the correct amount of suction is applied, an orange bellow was going to float in the window. If you see the orange piece floating in the window, the correct suction is being applied. If you don't see it, something's wrong. The suction is not at the appropriate level. So this is an example. In the first one here to the left, we see that the orange floater is not in the window, so the correct suction is not applied. In this picture, we see here that the orange floater is in the window, the correct suction is applied. And again, this is for a dry suction chest tube, because in a wet suction chest tube, we're using water. So what is good and what is not? What is good is, in the suction control chamber, we want gentle bubbling, not vigorous. Okay? So gentle bubbling in the suction control chamber is a good thing. That's fine. In the water seal chamber, we want to see water moving up and down with each patient's breath. That's called fluctuation. So seeing it move up and down in the water seal chamber each time the patient breathes is a good thing. What is bad? In the water seal chamber, which we were just talking about, it is bad if you see continuous bubbling. If you see continuous bubbling, that means there's an air leak, okay? So remember, it is good in the water seal chamber for you to see water moving up and down each time the patient breathes. However, if you see continuous bubbling, like the water is boiling in there, that means that there is an air leak. Call the doctor. If the fluctuation, the moving of the up and down stops, that could mean there's an obstruction. Call the doctor, okay? Some things. Never, for a chest tube, never strip or milk the tubing unless the doctor gives you an order. Milking is when you hold one part of the tube and you're squeezing the other part up to maybe get like a little clot out. So you should never strip or milk tubing of a chest tube unless the doctor gives you a specific order. You should never clamp a chest tube unless the doctor gives you an order. Always assess the patient's respiratory status and auscultate, listen to those lung sounds per the protocol to know how often you should do it. Always keep a clean, dry, occlusive dressing over the insertion site. Always keep the chest chest drainage system below the chest and free of kinks. Most setups you will see it will be on the floor, okay? And it has like a stand that connects to it to keep it from falling over. Always monitor your chest change drainage. You need to call the doctor if you're getting more than 70 to 100 mLs of drainage per hour. You need to call the doctor if the drainage is bright red. You need to call the doctor if the drainage increases suddenly. Also, what if? What if the chest tube gets pulled out accidentally? What you need to do is you need to pinch the skin opening together. You need to apply a sterile occlusive dressing, cover the dressing with tape, and call the doctor immediately. What would you do if the chest tube drainage system gets broken or is cracked? You need to remove the tube from the broken system, place the part of the tube that's being revealed in a bottle of sterile water so that you can keep that suction going, that water seal. Clamp should always be at your bedside in case the system needs to be replaced, but you can only clamp the system with an MD order, and then you need to replace the system. So in summary, it is normal to see the water rise and fall in the water seal chamber. Continuous bubbling in the water seal chamber indicates an air leak. Call the doctor. Always keep an occlusive dressing on the chest tube insertion site. If you found this helpful, I have many more resources, many more NCLEX questions to review with you, and many more principles that you need to know and understand so you can be successful with the NCLEX. If you want to pass the NCLEX, give me a call, 407-907-3737, or visit yourtimetoexcel.com. My Spring 2020 NCLEX review is starting March 2nd. I have the orientation Friday, February 21st. I'm going to be giving a free NCLEX style exam, review of rationales, and having a one-on-one session with each participant to discuss their concerns, goals, and strategies. If you're interested, again, give me a call, 407-907-3737. Thank you. Good luck. And remember, with God, all things are possible.